Dr. Coombs, why should patients feel confident in speaking up and being a partner in their care? Do you have any advice for helping them find their voice?
Oh, great question. I think a patient is their own best advocate. And, we as their physicians always try to advocate for them, but we often don't know what their wishes and desires are. And so I think through kind of speaking to what's important to you, that can help me know a little more about what path we should take, because there's not always, one right path. So I've talked about these two great treatment options we have. I had one patient who, loved fishing, and he just didn't want to, be in the infusion center. And that's the person who should go on the oral drug where he doesn't have to come to and from as often. And so if you kind of tell us about your goals and your desires, that helps us, also be your top advocate, because then we have a little bit more background on what's important to you. Mm-hmm. So yeah, I think that's my main thought. So we're here for you, but we need to know what you value the most. We don't always know that.
Right. When should a patient consider a second opinion or a consultation with a specialist?
I never discourage a second opinion. So I'm a CLL specialist, but I've had patients ask for a second opinion, and I'm always enthusiastic about it. If a patient feels that they need another set of eyes on their case, which, I've learned some things from some of my patients who have seen specialists, in different areas of the country, or, locally. We have Duke right down the street. Sometimes different providers just have different perspectives, or sometimes the patient, just needs to hear something again if it doesn't sound right to them. So I've had patients, for example, who are on watchful waiting, who really just had trouble believing I have leukemia and you're really telling me to do nothing. And, but then they hear it from someone else and it just helps it sink in. So I would say the answer is anytime you think you need another set of eyes on the case. But I would say especially for people in the community, I do think there's a lot of value in seeing a CLL specialist, once, if it's something, that you're interested in and your insurance pays. I think the community docs have one of the hardest jobs, and I don't think I could do it. There are so many different cancers that they have to know about. I think if anything, I have the easy job. I have one tiny slice of the pie that I know a ton about. Yeah. And so not to say that they don't do great jobs. I'm actually phenomenally impressed with most of the community. However, they have so much to know. Often you can, maybe get a little bit more of a unique kind of view on CLL from seeing a CLL expert, if that's in your interest, but certainly not mandatory, especially if your goal is to stay away from doctors.